students and practitioners. Those who are practitioners, they really 100% they understood all the concepts. I think all of them captured the principles behind and the medicine part, everything. But the problem is with the intensive student because now they have to start doing their own thing, they have to start seeing patients. Actual problem comes once you master the college, right? So examination is not what we face in our college days, but actual examination starts after we come out of the college and when we see the patients with all of reports. So here we have mixed types of questions. Certain questions are more about the theoretical aspects. Certain questions, the question itself shows the confusion part, and some part, of course, clearly practical oriented questions. And there are some repetitions in the questions. So most suitable questions, let me please, I request, we will select few questions. If at all there are any repetitions, we will not consider that because we have so many other aspects also to discuss with sir. Around 1 month back, I got an opportunity to go to one more seminar at Pune, which was about Mithapnika. One of sir student who is here, Dr. More, we got the opportunity to listen to his session, which was on diabetes. Hardly it was 45-minute session, but oh my God, really that session on diabetes mellitus really just by seeing 45 minutes, listening to 45 minutes, really came to know about it, what was the work done. For each and every case of diabetes, there is a protocol with Dileep sir. If a diabetic patient with report, sugar level is controlled, no modern medication, this is the medicine. With modern report, with modern medications, not under control, this is the protocol. So everything and comes only abhyasa rapyate drishti. Means vast experience gives that kind of command over the subject. So once again, sir, thank you. We will start the questions from the audience to you. The first question, starting from the basics. So what exactly these hormones we should consider? Some say hormones are a part of Agni, it is an Agni. Or some say it is nothing but the doshic variation, the various permutation combinations of the doshas. So before starting in detail about the thyroid disorder, what should we consider as hormones, especially the thyroid hormones? So, wonderful. May I know who has asked the question? It's okay, fine. It's a beautiful question because whenever we learn something, we should know what we are learning, whether it's practical, how I can utilize this information. At least we should think from the common sense of. Okay, so dosha dhatu mala sada dehasya samchala. Am I right? Dosha dhatu mala moolam sada dehasya. Did not say Shadira, did not say Kaya. Dehasya, Sada. Dihyatu Vajiyate. It's a metabolic body, always are in need of Dosha Dhatu Mala. There is a branch of modern science named metaphysics and quantum physics. Now define Dosha Dhatu Mala in modern versions. I will tell you that. Then I will come to the thyroid issue.
Dosha are biophysical energy manifesting signs of life. Doshas are biophysical energy manifesting signs of life. Signs, no science. SIGNS, signs of life. According to modern biophysics, movement, response, synthesis of energy, reproduction, etc. Andasravam, that is excretions, secretions, visarjanam. So, coming to the Ayurvedic point of view, doshas are Vata Pitta Kapam. Vata can be interpreted as neurodynamics. Neurodynamics. Yatra Tantra Yantra Dharaha. Tantra Yantra. Tantra is the philosophy or principle to operate. Yantra is the machine to use that Tantra. So, body A to Z activities, biophysical activities in the form of neurodynamics are demonstrated by Vata, Panchavayus. So, Pitta is considered as hormones or enzymes. There is nothing else. Hormones are Tapa Santapi Pitta. Vagati Gantanayoho. Vata, you know that. So, Pitta Tapa Santapi, any metal that has heat and making heating adjacent thing by a process called exothermal reaction in biochemistry is already named as pitta, which is actually called as enzymes or hormones. Enzymes participate in exocrine reaction or endothermic reaction. Hormones their role in exothermal reaction, where heat is liberating after the chemical reaction. So ultimately, temperature is a play of temperature, game of temperature, utility of temperature, burning with the temperature, oxidation for the synthesis of energy. Ultimately, pitta is considered as hormones or enzymes. Kapha jena jena palita, jena jalena palita. Some people wrongly say palita, it's wrong. Palita, palitam. Angam palitam. So palitam means it's a binding agent. Kapha can be binding agents with the help of fat and water. I already told you. So in snihyate, snihalingane, slashma. So here Vata can be neurodynamics, Pitta can be hormones or enzymes, Kapha can be any binding agents with the help of fat and water. So that binding is made possible by movement through Vata and principle by Pitta in the form of enzymes or hormones. Thyroid, coming to thyroid, no, we are focusing only to T3 and T4. Okay. Iodothyronin T3 and thyroxine T4. But there are other hormones. Have you ever heard? Modern anatomy is not complete. I am an anatomy teacher. I was a dissecting teacher. 19 years I was teaching. Dr. Dayanand is not here? Yes, left. Okay. So, I was an anatomy teacher. I was a Shalakya teacher. I was a Panchakarma teacher. I was a regular teacher. So, very unfortunately, as there is no faculty, I happen to teach. So, I got the destiny, gave me opportunities to see what is the syllabus and its practical inputs. That way, I utilized anatomy in Marmavijnana and also in physiology, surgery, and that there was no department system. So, create there's a tutor we were teaching. So, nearly 11 years. So, here, thyroid functions, we consider it as a tarpaka kapha with pituitary secretions, one of the anterior pituitary, tarpaka kapham, but any binding material formed with the influence of anterior pituitary hormones are tarpaka kapham. Not directly, any binding material produced because of anterior pituitary hormones or Tarpakagapam. It is not completely illicit. Modern medicine has not proven the theories of Ayurveda. So still, documents are collected. For example, how a calculus Pashanabheda rectified idea like regarding thyroid measurement, it is limited to anatomy and physiology, complete. So at present, what in Ayurveda, we need to if I said Avalambaga, say Avalambaga Kapha, the materials of postal pituitary, materials of postal pituitary and the materials of anterior is Tarpaka Kapha. So this is versions and versions. So we are interesting that this is called bioinformatics and also molecular biology. Bioinformatics and molecular biology are the two areas now they are focused only since 2 years. Bioinformatics and molecular biology they are only interesting now. Ayurveda is too much. Lots of information is in our system. Mahadrajam, Pitrajam, Desajam, Satvajam, Atmajam. No definition in modern science. Law of heredity. So similarly, coming back to hormones or enzymes are definitely can be considered as pitta, no doubt. So every manifestations here pitta is not Panchaka pitta, five pitta. You just segregate it and go ahead with applied anatomy. You can make MD anatomy in that way. Entirely you can do. You can document it. Yeah.
Thyroid-stimulating hormone. The factors which are responsible to secrete this TSH hormone. That you told us Karpaka Kapha, it's a part of Karpaka Kapha, right?
See, basically bone matters here. We have Sukha Dhatu, Sthola Dhatu, Poshaka Dhatu. Okay, we have Sukshma Dhatu, Sthola Dhatu, Poshaka Dhatu. So, Poshaka Dhatu is the factors affecting in thyroid dysfunction due to TSH anomaly. Because I already told you calcitonin. Only calcitonin is invented. What other hormones still to be invented out in anatomy? Procalcitonin in septicemia, bacterial infections, again disabled calcium utilization. So here, bone health, this is actually considered as Dhatogni of Medo Dhatu when it becomes Dhatu Dushti, causing Uttarattara Dhatu Pranamam, low production of bone can be interfered as that procalcitonin, okay, as a effect of TSH. Okay, which is the Sukshma Poshaka Dhatu anomaly, impairment. This kind of versions be it interpreted, but there is basically these all theoretical things. So you can talk, you can write, you can present, no problem. But it won't serve the purpose for the welfare of the people. So this is fine for discussing. This kind of discussions are happening. So I also participate a lot of things. I wish you people to be more focused on burning practice.
Many more such. So we have started with the theory part and come to the. Sir, have you in your clinical practice observed that particular Prakriti persons, maybe Kapha Prakriti or Pitta Prakriti persons, more getting these thyroid problems?
Wonderful. See, thyroid problems, functional problems, and hypothyroidism are not directly mentioned in classical wisdom because this is a this is a disease of urbanization. These all are diseases of urbanization. It is never built in, but hardly we can equate with thyroid versions and all. Coming back to Prakriti, that is why Prakriti has no relevance with this. It has got more with the derivation. Prakriti means, see, Suklatra Garbhani Puja Chesta Garbhasya Toshu Chadoshadir Sana Prati Sabdatha Vidaha. Pak Kriti di Prakriti, Janma Marna Andala Pavani di Prati by Palam Patain. So, Prakriti is totally different thing. Body constitution we say inferior language called Sanskrit. Sorry, English. So here, coming back to Prakriti and thyroid disease has no relevance. We get the manifestation of difference in symptoms can be reflected in different Prakritis. That's correct. Every Prakriti can be intoxicated. What is the Prakriti get skin problems because Athara Adhaya very correct. Victim to Swadrakyo. In Tok or what is that? You remember the sloka Tatra Astinis to the white Victim to Swadrakyo. Isn't it? So bone problems and skin problems are reflected in Vadiga Prakritis. So issues of skin tone, sweating issues, bad odor, dry skin because of low sebum in the sweat. Again, acidic pH in the more ammonia and more accumulation of nitrogenous waste in sweat. Maybe scenario versus the tone of the skin, UV intolerance, everything is in Pitta Prakriti. Sweat the recta. Again, problems with the hematological, causing epistaxis, hematemesis, all kinds of bleeding disorders. Plus, what Bandhana Shesha, arthropathy, loosening joints, low radio density of synovial fluid, lower in the alkaline pH of synovial fluid, tenosynovitis, tendinosis, bursitis, in knee, even that spine discitis with no definite cause can be. A Bandhana Vishesham in more having a kapha because this kind of difference in manifestation can happen, of course, based on that, when the Prakriti was equally distributed. And Rutu is also another reason in that Prakriti. For example, Vata Prakriti with complication manifesting more than Varsha Rutu. I have clearly observed it. So it's actually very complicated. My father is a retired vice principal in a government Ayurvedic college. He was a great scholar. He made a big circle of whole season and made every manifestation. If you see that circle, he took nearly 21 years to complete that circle. He has written everything. Prakriti, disease, seasons in modern month. As per Kerala ecology, and he made a beautiful chart. I have with me. And thing is, that kind of influence you need to consider when you are treating a patient, because one medicine, if you are treating in Sharad Radu, sub-autumn, will become resistant in Kapha Prakriti in Vasanta Radu. So this is very interesting. Not doctors usually observe it. It clearly reflects in Amavata. That in thyroid problems. This one, Chitraganati Kashayam, give good result in Kaprakriti in Vasanta Ratu. Unfortunately, same medicine become resistant and morning stiffness, Antarjar, pulse increases, Pitanadi become next disease. Grishma Ratu, summer season. So it's very clear. 2 months each in a year. My father categorized 6 Rutu in a year. So it is beautiful. That kind of observation is there, but it is very strenuous and difficult you to apply the Vedic wisdom in the practice. It is not impossible, but you have to ignore complete modern pathis. You have to be clear cut Shuddha Ayurveda Chikitsaha. Then it is possible. Dosham, Desham, Balam, Kalam, Anala. See, Sushma, Sushmya, Samiksha, Yasham, Dosha, Aushadha. That's what is happening here. Dosha, Aushadha, Nupana. You don't need to see modern, but you just throw every modern medicine. I know Vaidyas. Like that. Through them only I have been taught. My father's guru, Keshan Vaidya, 11 years I was his disciple. So he threw every documents. Suddha Ayurveda Chilsaka. He was steroid. Nothing happened. Those times, this is the 90s, I'm telling, mid-90s. See, there is a treatment system. There was, see, I was only were there now earlier. So if you are interested, you can throw every current practice in medicine, including modern Ayurveda, and become a Shuddha Ayurveda Chikitsaka. It is possible. So 100% nobody can compete with you. Only one condition, quality medicines. Yes. Bahukalpam Bahuganam Sampanna Yogi Mokshatam. Otherwise, everything is waste. Whatever I know, whatever I hear. That's why I usually nowadays don't go to service. Coming back to the question, it is possible there are influences, not only some prakriti, like this. Every prakriti get influence of thyroid toxicosis. Actually, it's a toxicity. Thank
So
you.
you used a wonderful word that is modern Ayurveda. So
Modern Ayurveda. When you apply a Vedic wisdom for a modern society, it is named as modern Ayurveda.
okay,
It is not time tested. It will change. Like allopathy, it will change. The Vedic wisdom will never change. It is one. No fourth, no fifth dosha after that if you consider. No, this one more shakhas. Only three Roga Marga. Any more?
no.
No. No more than no three dosha. No Sabda Sadhu more. Modern also. Nothing more. What is that? Extra. Three Mala. See, Malas are metabolic. See, dhatus are biochemical constituents participate in biochemical functions. Biochemical constituents, metaphysics and quantum physics. Malam are three forms of waste to be evaporated on time. That is the correlation.
Yes, sir. Just you mentioned that you were teacher for Shalakya also, and we all studied Shalakya. In Shalakya, we studied Galaganda Gandamala, and whenever under the heading of Galaganda Gandamala, we used to study hypo and hyperthyroidism. So can we tell Galaganda is equal to thyroid, thyroid problem is equal to Galaganda?
Galaganda Gandamala can be equated only with the growth of thyroid. It has no relevance at all with the thyroid dysfunction. It has no. Tell me.
So if there is a patient with increased or decreased PSI or imbalance in the T3, but there is no actual study, so that cannot be considered as Kalakanda. So the correlation is completely wrong. The correlation, that is, any case of thyroid dysfunction, we name it under Ayurveda as Galaganda. It's wrong, right?
Completely wrong.
So this is where the theory and practice completely differs. So in theory, I think most of us have written. So under the heading of Galaganda, most suitable the translation or the correlation is thyroid. And sir, one more, yatra yatra Galagandaha tatra tatra kanchana gugulu, right? Similarly, yatra tatra thyroid functions or thyroid levels imbalance tatra tatra kanchana gugulu.
No. Kanchana Gokulu, we are indicating only if there is any isthmus enlargement, any structural anomaly of gland. It can be a calcification, it can be a complicating growth to inside. Okay, it can be a bilaterally symmetrical, asymmetrical enlargement, or it can be a medullary thickening, or it can be a nodule from the medulla, or even it can be a extramedullary or cortical epiphytic cyst. All can be considered as different types of ganda, but If it exhibits an autoimmune nature, we call it as Vadika Galaganda. Autoimmune generally refers to Vadikam, suppurative infective refers to Vadikam, cold and enlargement refers to Kapajam.
So, this is, there should be growth. There should be,
Must have to be.
to prescribe Kanchanara Pukulu.
Absolutely.
Got it? Okay. Sir, is it possible to explain the Samprati? I mean, keeping all the reports and everything aside, a patient diagnosed with the thyroid imbalance, keeping the report aside, can we diagnose the case only based on Ayurveda?
Not possible. Only with the asymptomatic you are asking, na?
Yeah.
Asymptomatic patient with only a printout. Only one thing we need to ask. Stristambham. Ahara, Nidra, Abhrama. Ahara means just ask. Circadian rhythm. Are you feeling appetite on time? Do you have feeling of fullness? Do you have desire towards a particular taste? Do you like to skip food at night? What will happen if you skip breakfast? Is it will become intolerance? Lots of questions are there to ask, but we are not asking that. We are only focusing on bring out. So if you ask that, if you rectify that problem, but patient is not voluntarily revealing, definitely TSH can bring down without electrolysis. Are you understanding? So, Vikalpam with Ahara Vidhi. Vikalpam with Ahara Vidhi. Getting more appetite frequently. Not getting appetite on time. Getting after food stomach, water to be no, only again we are getting appetite. Ashokta has dropped down to. But again, feeling of fullness, we said. ಸ್ವಲ್ಪ ಒಂದು ಬೇಗ ಹೊಟ್ಟೆ ತುಂಬುತ್ತೆ. And you will deny the hotel man will say you will add the soda and the rice. Okay, so kind of and not getting thirst, not enjoying sweet. Shadrasukta, if you stop taking sugar, you will die. Swadhamana must be there in the food. In the name of so-called sugar, if you stop taking sugar, you will die. Your firstly sense organs, then brain, then heart muscle, bone cave, then bone marrow, brain. Maximum serious value. EDS. Everything will happen for males. So I'm telling you, Sandarpana Mayava Gaidhyam. What do you do? We say to cut the sweet. What is the rules of Prameha and diabetes? Both are totally different. Prameha is different, or diabetes is different. Okay, so coming like that, this is the conflict. So Ayurveda is a Vedic wisdom, time tested. No time testing. So here, Ahara I told, Nidra. What are the questions to ask? Are you getting sleep on time? Are you getting sleep at daytime? Are you waking up frequently? It is starting trouble. Here is small sound, I am getting wake up. These all questions you did, this part of personal interrogation. We are asking that because we don't believe. That's what. Tristambham. Second one is problems with the sex. This part, if it is clear, 100% the person is wrong. You don't need to treat him. You just tell him, take alkalizing food and everything. People alkalizing food. Cucumber chutney, ginger chutney, amla chutney, morning along with the breakfast. Why should you treat if the patient has no complaints? He's a mental patient. You counsel him. TSH may be more than I have seen TSH. Not people. I Hamid from Madapalli Airport. His TSH is zero. I shall show you that one. T4 zero. What is the relevance of the test? T4 zero, TSH, T3 is less than 30 and TSH is more than 100. That's the report. He never got any medicine. It's like, you know what? He is working in a prior department. Means where he is getting nuclear emission. I told him, either resign and keep on checking. Otherwise, you don't check, keep on working. Don't come to me. His money, my medicine. Donor, waste हो जाएगा. His money, my medicine. So this is another stupidity. Okay, so that's my conclusion. Okay, Dr. Ji.
Yes. So one more question related to the same thing. Suppose a patient comes with only raised TSH value. Raised TSH value. Why can't it be considered as Purva Rupavastha of Galaganda or Purva Rupavastha? It is in Purva Rupavastha.
Wonderful. Elevating only TSH, I already told you, because of infection, sepsis, ENT infection, I already told you, climate variations, nearly 29 pathologies for only TSH to increase. 29 pathologies have already been ruled out. But it is not a problem with the thyroid. Problem including stress factors and psychotic drugs. Many like oxetol, sodium alpirate, oxetol, and what is that? Levetiracetam. This kind of, and again now acetate, phenytoin, and sodium alpirate. Already told you, one was Cidrapa plus. These all medicines lead to derangement of TSH. So we need to ask this question also, whether he is on medication for neuro problems. Plus, TSH only increase again among pasturarians. You know what pasturarian? Fish eaters. I know some of you may be very fond of eating fish. Fish contains nuclear emission. Fish with scales in the sea. Okay, because of the nuclear waste dumping to the deep sea in near to Mumbai and also Tarapur and Kodamkulam, Chennai, and also in Kochi. So where Whitefield, Cherai, Naramal, I have made a 21 kilometers, square kilometers place. Lot of people are suffering from aplastic anemia, myeloid dysplastic syndrome, myeloid leukemia, lymphoblastic leukemia, and also thyroid carcinoma. And everybody, 100% people, even a newborn baby, TSH is high. So it is already documented as because of nuclear emission. So again, these what are the factors I just wanted to tell you. Fish is innocent. Fish is not the matter, but we can have freshwater fish never cause that problem. Freshwater fish, no problem. So that is the common reasons I have found, and I already told you biscuits. Biscuits, every biscuit contains emulsifiers, autoflavors, antioxidants, fermented colors, leavening agents, and transfer preservatives. These 6 ingredients contained in the biscuit can also increase TIF. You know what? Tissue inflammatory factor, and TNF, tumor necrotizing factor. That's the basic cause for every disease in modern India. TIF and TNF. Tissue inflammation factor, second tumor necrotizing factor. So these we cannot ignore. Being Ayurvedic doctors, you please try to make public understand about the reality. Okay.
The same question. Suppose only TSH is increased and then you give one best home remedy, apple, carrot, ginger, lettuce. Suppose apart from that, we need to prescribe some medicine, which would be the most suitable medicine in this condition.
Wonderful. Three medicines we can give. One is Neelon-Palati Kashayam. I have not given you. Neelon-Palati Dana. Sushrada Samhira. Neelon-Palati Dana Phantom in empty stomach. Neelon-Palati Dana Phantom in empty stomach. Second, Guluchadi Phantom. Neelon-Palati Kashayam in autoimmune nature. Vatikam. And Guluchadi Dana in Kapajam, where they get in drowsiness and sleepy mood swings, etc. Stress factors, Gulucha at night. Next, our Ushiradi Kashayam, Ushiradi Phantam, again in the morning after breakfast, for Paitiga Amam. Understood? So, Vatigam, Neelal Paladi, Kapajam, Guluchadi, Paitigam, Ushiradi. Ushiradi Paitigam we are giving after breakfast at morning. Neelal Paladi in empty stomach, Guluchadi one at night. Okay. After dinner.
Yes, sir. And in this condition, suppose any specific dinacharya that we have to follow, and which are also apatya, which we should
Wonderful. Very practical question. Morning sunbath between 7:30 and 8 o'clock, 3/4 of body, maximum 10 minutes. 3/4 of body between 7:30 and 8 o'clock, South India. Sunlight sunbath. Drink 2.5 liters maximum water, not than 1.8 liter. Not than 1.8 to 2.5. We have to regularize the water intake. Do not take nuts. Walking, running, jumping, swimming, playing are mandatory. They are not vyayama. Please don't misinterpret. We are animals. We are not big people. We are animals. We are not plants. We are animals. We walk, jump, play, run, swim. Any one of this mandatory. Understood? So that is a second lifestyle. Third one, I already told alkalizing food in the form of coconut chutney. Coconut chutney, ginger chutney, coconut chutney. Either ginger chutney or cucumber chutney or amla chutney. Okay, and do not take Basalai Sappu. Malabar spinach. I know you are very fond of taking Basalai Sappu. Extremely sorry, Karnataka people. But people own thyroid therapy. Malabar spinach or so-called Basalai Sappu is found to be unsafe. It can lead to bone degeneration and cartilage dehydration. And it can lead to costochondritis in long run. If you regularly take at least twice in a week. I wanted to tell you, stop taking all fried foods from outside. Bad oil fried, it will have lot of trans fat. Trans fat will affect your thyroid health adversely. Stop all fried foods from outside. You can fry whatever at home in pure oil. Don't take any fried food from outside. That's all. Cashew, pista, badam, walnut, peanut. Cashew is regularly tell to people. Kannadalli ಅಷ್ಟು ಬೇಕಲ್ಲಿ ಹೇಳಲಿಕ್ಕೆ ಆಗಲ್ಲ. Okay, cashew ಬರಬೇಕು ತಪ್ಪಲಿಂದ pista, badam, walnut. That means cashew nut, pista, badam, walnut, and peanut. All nuts are dangerous. It contains lots of fungicide, chemical. Yes, you can use if you have ನಿಮ್ಮ ಮನೆಯಲ್ಲಿ ಕಾಶು ಮರ ಇದ್ರೆ ಅದ್ರದ್ದು ಎಷ್ಟು ಬೇಕಾದ್ರೆ ತಿಳ್ಕೊಳ್ಳಿಕ್ಕೆ ಏನಿಲ್ಲ. ಏನಾಗುತ್ತೆ, ನೇಚರ್ ವಿಲ್ ನೆವರ್ ಕಿಲ್ ಯು ಬಟ್ ಮ್ಯಾನ್ ವಿಲ್ ಕಿಲ್ ಅನದರ್ ಮ್ಯಾನ್ ಫಾರ್ ಮನಿ. ನಿಮ್ಮ ಮನೆಯಲ್ಲಿ ಆರ್ಗಾನಿಕ್ ಆಗಿ ಬೆಳೆಸಿರುವ ಪೀನಟ್ ಇದ್ರೆ ಎಷ್ಟು ಬೇಕಾದ್ರೂ ತಿನ್ಬೋದು, ಗೊತ್ತಾಯ್ತಲ್ಲ. ಸೊ ನಟ್ಸ್ ಆರ್ ಡೇಂಜರಸ್ as man pollute.
So as you are mentioning about the pesticides, so most of the diseases are due to food toxicity. As you were speaking, whether it is diabetes or including the thyroid, then which is that specific medicine or yoga that can be given as common as for food toxicity? Because all of us will have same kind of food. And the patients, of course, we may tell them not to take this, but most of the he is having certain chemicals or other ill effects. So how it can be treated with the suitable yoga?
ಜಗವಿಷನ್ನಾಥ್ ವಿಷಭ್ಯತೆ ಬದೀಯತೆ. Jagavishanath. This is Agadadanta. You have once upon a time you have learned it. Jagavishanath, Visham Itya Vidiyate. Jagavishana means you are intoxicated, like William Blake, poison tree. You all are poisonous. So the poisonous animal, including me and you people, if you bite a tribe, will die in hours. You know that? If he bites, nothing will happen. He will die if our blood is in his mouth. Because Okas happening. We are intoxicated. See, in that scenario, if you do practices for a healthy person, it will spoil your health. So yoga, Chitta Vritti Nirodha is good. If possible, you have to work hard in our nation. Second thing, Surya Namaskara. What do you say? Surya Namaskara, do you know? Wonderful. And Neti, Jalaneti, or voluntary vomiting, or Surya Namaskara. Any one of this is wonderful for detoxification process in terms of neurotoxicity in Schwann cells. Do you know that? Italian anatomists found out Schwann cells from where nerve regenerate. So the neural level poisoning, when it is affected, it affects your brain, spinal cord, and autonomic nervous system. It will tend to slow. MR will be predestined. So, Bhagya Buddhi Chabar Mehta Tab Drishti Shukra Ugrama Buddhi Karma Kera Jivana Sarandara Samira Pura Kanda 120 years, one by one will pass. So, it will become 5 years or 4 years, we will die in 60, 70s. So, I am coming back to the basic metabolic rate. These are the some steps which I usually recommend to people who are immensely rich and not going to public much. Immensely rich people now who are residing only at house and going to foreign countries often. There we get good food. Sorry. Nepal, Bhutan, Sri Lanka, neighboring comparatively poorer countries, they never pollute food. They never pollute food. If the food is rotten, they throw it out. Indians are not like that. They will never not like that. So rich people go, they would take good food at home, peaceful because they have a lot of money. Everywhere money matters, no. Man will only good money, naturally. So outside India, so they go to foreign countries, take good food. I know a lot of people like that. Then I recommend this kind of thing, 3 things, Surya Namaskara, they are happily living. Because they know MGR, he was millionaire. Lot of film stars, they are millionaires. See, money will not save you. Every rich man should think like that. Money, you have to, it is sought to be handled very carefully. That's why this kind of categories I recommend. Otherwise, I recommend it to the layman.
Sir, what about Aushadhi Yoga? Vishakna Aushadhi Yoga.
One of Lucy Vishali tablet I give. I am using it as post vaccination side effects. Lucy Vishali tablet, spike protein induced CDA, spike protein induced MI, spike protein induced bone marrow disorders among B positive or O positive blood groups. I recommend Lucy Vishali tablet.
Dushi Vishari?
Gulga. Be prepared. You can use it. It is to be taken before food. It is to be taken before food. So, as a preventive thing, I have found the problem of the glycemic index. When we affect with the poisoning, the adverse effect on eyes, liver, bone marrow have already proven as prevention. So this is a wonderful medicine. Tablet 2 BD before food with a quarter cup of water. Morning you have to soak. Even you have to even you have to soak. Next day morning you have to take like that. 1 month continuously. Yearly 6 times with alternate months. 1 year is enough.
Yes, sir. You were speaking about the Gandusha. Gandusha with the cold water. When you enter to the bathroom, then have Gandusha. Sir, is there any other such simple tips which can be followed? Question number 1, sir. One more question that came was, if you were to take hot water bath, but not to the head, but it becomes Vatyata Ushna Shita, does it become Pushtamida?
Never. Chakshus tejo mein tattva vishesha srashana bhav, isn't it? Chakshus tejo mein tattva vishesha srashana bhav. So here, below neck. Before I wanted to tell you some formula for Gandusha, then I will come to Gandusha. Panchatitragan Kashayam. Panchatitragan Kashayam. Panchatitragan Kashaya. Prabbala Aragadatvaka, one formulation. Second, Panchatitragan Kashaya, Haritra Churna and Agiru. Panchatitraga, Haritra, Agiru. Third formulation for Gandusha, it is in carcinomas. First one in hypothyroidism. And thyrotoxicosis, Nagpamara, Panchakshiti Vrikshagana, Haridra, Daruharidra, Nimba. Panchakshiti Vriksha, Haridra, Daruharidra, Nimba. For hyperthyroidism or thyrotoxicosis. That is what Gandusha. Okay. Next, we are telling
Ushna Shita.
Famous actress Sridevi reported as that died in bathroom. She was on aspirin. She was on anti-platelet medicines, clopidogrel, Berlinta, epinephrine, and ecosprin. Our pet geriatric supplement. You know that? Yes. World's most favorite geriatric supplement, like Horlicks, started from the American Medical Association, giving us a regular Horlicks, anti-platelets Horlicks, called aspirin, clopidogrel, Berlinta, epinephrine, 4 tablets. When you take this, if you directly go for a cold head bath, you can have a basilar artery CVA, mind it. So that is when I got information that the Vedic wisdom was right. Because it will be very, hypothalamus will get really strenuous, will get reflect in endocrine distress of thyroid function when hypothalamus is in trouble. Because that is where thyrotropin releasing hormone needs to be there for stimulating the TSS production. So thyroid distress will definitely affect you. Firstly, bath, head, and full body if you do with the warm water. Body always keep 2 degrees more than the atmospheric temperature. For example, the heart was muscle in the testes. That's why it is displacing. So here, like that, if you consider the hypothalamus will be properly managing the situation of bathing by regulating all the endocrine harmony. If you firstly bath with warm water below neck, then easily the cold water bath will never cause any side effects or nuisance like if you do vice versa. You understood? So it is really dangerous if you firstly go to head cold water bath.
Yes. So, does Shirodhara help in thyroid related problems? As in thyroid problems, there are so many mind related nidanas are also involved.
Wonderful. Purva karma, pradhana karma, pashat karma. You have already learned it. No? But there are some kalpana we separately instruct as a swatantra chikitsa. That's called upakalpana. That's called upakalpana. Shirodhara alone can be done. Takradhara alone can be done. Abhyangam alone can be done. So after that, Swayam is not mandatory. So such application of Purva karma and Pashat karma, we call it as a upakalpana. Shirodhara is a bahya snehanam. Okay, so there are two types of snehanam. Bahya snehanam, abhyantara snehanam. Anta abhyantara snehanam, acchavanam, vijara snehanam. Anta acchavanam, brahmanam, sodanam, samanam. Coming back to the bahya snehanam, there are Shirodhara, Mastishya, Shirovasti, Shiropiju, Utvartana, Usadanam, Sambahanam, Adaghanam, blah blah. So here, Shirodhara is a Bahya Snehanam, not a Svedana. So you should not heat the oil. I know a lot of places people heat oil before the Shirodhara. It is wrong. It is a part of Bahya Snehanam. Abhyangam is not one or A on B. Acharya, Maya Acharya. I have to own my body. So coming back to Shirodhara, it is a one upakalpana only in hyperthyroidism where disturbed sleep, anxiety neurosis, and ophthalmologic involvement like poor refractive index contributing astigmatism. This situation Shirodhara is ideally recommended.
And this dhara is with the thaila or takra
Thaila, purely Thaila, usually Ksheerabala Thaila. Ksheerabala Thaila or Dhanvantaram Thaila and Karpasasthyadi Thaila in elderly people. Karpasasthyadi Thaila should be in Kharapagam. Okay, should not be Abhyanga Kharapagam. Dangerous if you use Madhyamapagam. So you have to prepare Thaila for Shirodhara. Don't trust company medicines. It will make lot of nuisance because the kalka is very important. Shirodhara, it will create vascular headache after the dhara. Then you will say it is common. Don't worry. Keep quiet. Headache will get you. So please listen. You have to prepare thyroid for Shirodhara. Wonderful medicine. This context.
So now coming to the hyperthyroidism. Hyperthyroidism can it be considered as pittavritti or atyagni mentioned in Grahani Chikitsa?
Hyperthyroidism can be considered as Ashtonandita dosha. It is only one part only has been explored. Ashtonandita Purusha, one of the you just take the reference to Ashtonandita Purusha. Hyperthyroidism is not because of it is an environmental poisoning. Government of India and WHO say it is because of environmental poison and this one radiological exposures like radio, what do you say, radiations, correct, radiations. So that kind of people, even a CT computer tomography emission even can cause problem. So hyperthyroidism people are not supposed to undergo any kind of contrast, FPG or gadolinium in MRI. It will cause lots of nuisance. So hyperthyroidism usually is a constitutional manifestation. In my survey, hyperthyroidism is a constitutional manifestation or it is a supersensitivity with the certain allergens. Need to be ruled out, somehow ruled out. So when I have cross-checked with the, this one, text, the Granthas, I come to know it could be Ashton Nindra Purusha. Because what is Purusha? Puri Shetai. Vivid functions in a township, Purusha. So here, Ashton Nindra Purusha is a conceptual manifestation if the Prakriti becomes Vikriti Purusha Samavaya. So, otherwise, there is no definition for get away with this one, the thyroid toxicosis and hyperthyroidism. And it is absolutely a Visha Tantram, Agata Tantram. Exclusively Visha Tantram.
Hyperthyroidism is exclusively Visha Tantra.
100%.
So all Visha Chikitsa can be adopted in hyperthyroidism.
100%.
So I think many of the practitioners also, students also got clue for the treatment, right? Sir, you mentioned food toxicity, and toxicity, can it be considered as ama, number one? And second one, if we use rasaushadhi, that also can create toxicity in our body, right?
Rasaushadhi or Devi is absolutely wonderful management system, but unfortunately, the safety and purity in the preparation is the problem here. Okay, so the raw materials, the plasma you are using for raw materials in the tablet, there's a lot of adoration. We don't get Swarnamakshika, we don't get iron pyrite, copper pyrite. Lots of medicines are absolutely, we don't get it. So, we get, Yavatharam is Hajuru Ahuda Vasma. Unani is using. Now, we use potassium citrate, but modern people use for stone. So that's what in the name of that, both of the Vasma use as Yavatara in some places. So, original Yavatara is stone. I am coming back to, this is the problem with the Ayurvedic doctors, as they have not required institutions, Ayurvedic doctors, Ayurvedic versus RRI, and politicians, policy makers in the bureaucracy level, all are responsible for the destruction of Esachilsa. In Konapadam is the pharmacopoeia in Tamil, they use Siddha medicines. Ilgul Abda Taklis, Unani, Epigonum, particularly in Ayurveda, pharmacology in Western medicine. So here, all the shakhas, Rasa Shastra is not coming in any one of this. It is totally different. It is never coming in Ayurveda, so government need to take more focus and we need to get. So it is actually not safe for long time consumption if you are not preparing it. But nephrotoxicity, basically it is a nephrotoxicity, arsenic, harithala, etc. But it is treated properly, it is wonderful, it is super medicine, far faster than Ayurveda, even modern medicine. I have seen a lot of cases, my students are practicing Orissa and Andhra, they are getting wonderful psoriasis and all, in 1 or 2 months they are completely recovered because they prepare habit by their own. So we cannot degrade that. It's a problem with us, we do not prepare good medicines. And another thing you are telling, Ama. 4 types of Ama, as per Chikilsa, Achalam, Chalam, Alinam, Leenam. Achalam is the gastrointestinal consent, Ushman Alphabet, Dhatum, Adim, Avajana. Okay, that's all the Melpums go and Motala. Vishuchika Alasakam, what are the effect of that? You can use your treatment for rectifying that level, which is a Chala Amam. Mahastava Samantha. Chala Amam is Rutuja problems, allergic problems, seasonal problems, Samapadam, Samapadam, Samakapam, Ashtanga Sangraham are coming under Chala Amam. Okay, so third one, there also you can use your medicines, but you can use Rudajiriya, Shidodham, Doshajay, Vasante, Vishodhan, Grishma, Pragale, Anadi, washing washing, the Logan, Rudajan, Jatu. That logic you can apply in Chana Amam, Ruduja, Yogas, and food allergy, quarantine allergy, any allergy, character allergy, best, everything you can consider as Chala Amam. Third one is alinam, which is not fused with the dhatus. Any chronic disease, unilateral arthritis, 10 years chronic arthritis, diabetes, IVDP, splenomegaly, heart attack, liver problems, bone marrow disease, chronic diseases, psoriasis, all are coming under alinam. These first three stages, you can use any medicines as per both of empirical documentation. But the fourth is called Lina Ama or nothing but Ashtamahagada. Wherever Chiksa Sutra is indicated in the Samhitas are coming under Lina Ama Vyati. Lina Dhatu Krista Bharat Amar Saneva. So you have to be very careful. Don't use your logic in treating Lina Ama Vyatis. So every Chiksa Sutra, so you should know how to implement the Chiksa Sutra. Lenkanam Padram Tintu Sahavan isn't it? Virechaha, Snehukta, Snehukti Virajani, so every disease of what Chikitsa Sutram, it is exclusively for. I'm just telling you, Ama application the Chikitsa. So that is what I am teaching to doctors in my webinars. How to utilize Chikitsa Sutram in the practice. First what, then what, then when to stop. How to, I think in college we never teach it. Nobody is learning how to implement it. Chikitsa Sutram. So that's what I wanted to tell you about Amma.
Sir, in your entire presentation, we didn't see about Shodhana, especially in the morning session. So, does that mean actually in thyroid case Shodhana, there is no much role of Shodhana? Yeah. Or if at all, we have to do Shodhana, Vamana, Virechana, exactly in which condition where?
Vamana is contraindicated in thyroid disease. Vamana is contraindicated totally.
Is it?
Even absolutely. Every thyroid disease, Vamana is contraindicated.
What about hypothyroidism?
100%, because I have got a lot of big experience. I was a Punjab teacher trainer long years. So in Kerala Pharmacy KPL. So Vamana is contraindicated because it is a Pitta Bhava. Pitta Vikaram. Vamana is contraindicated. Already told in Samhitas. Coming back to Nasyam. Marsha Nasyam is very good. Marsha Nasyam. It is a 2.5 hours time consuming Nasyam. Marsha Nasyam. Okay, so we can do that Panchakarma. Only Marsha Nasyam is indicated in thyroid, all kinds of thyroid. We have to change the oil for Nasyam.
Sir, so in that case, Pratimarsha can be advised for all patients of thyroid problems.
Pratimarsha can be administered only among people with the infective background of upper respiratory tract leading to TSH elevation. Otherwise, no required.
Sir, in Bhava Prakasha, there are many external Lepa yogas mentioned. So, these can be used in any conditions of thyroid disorder?
100%. See, I am using Marnavadi Churna, Ayurveda Pragashika, best book for Lepakalpana, Ayurveda Pragashika. I am using Lepakalpana's Pradeham, Alebam, one more thing, Pradeham, Pralebam, Alebam. Pralepam, Pradeham, Alepam. Pradeham is the technique here. Both three things are different. Pradeham is a technique here to use. Means warm poultice. Warm poultice and taking it, I was using abundantly long Marnaladi Churna for thyroid carcinoma. But I can supply you, we are preparing that super medicine. Only one condition, should never do FNAC. If you do Pradhan to a thyroid, okay, it will definitely trigger the patient within no time. Maximum 10, 50 days it will make it complicated. So this I have not mentioned because it's very vast. I can give you lots of formulations like that. Kushna Dilepam is there. Vacha Kushna Dilepam and Marnaladi Churna, Nimbadi Gulitya Dilepam. Many lots of flavors are there.
And all these papers are used only when there is I mean
100%. Only there is enlargement, not in functional problems.
so not in functional problems of thyroid external you said it is only in case of with exactly the Ganda or Gandapala.
Exactly.
And just you mentioned as FNAC, there is one question that okay, then any patient who comes to you with the FNAC report, will not take the case?
I will never accept. I accept if they request like anything, we'll see 1 month. Sroto Buddhamado Vaitya Pratyakhaya Prasadayat, isn't it? So just I will tell you, if it is triggering, I will reject you. But unfortunately, some cases respond positively, then I will have to continue. But 99% I have already my junior doctor to reject it. Don't come. Still some people come, I may accept, 1 month I will try. That's what.
And follow up of that, even after your treatment, suppose that swelling doesn't decrease, even in that condition, don't you advise the patient for FNAC?
Fine. After I will say maximum 1 month. I will not keep the patient without more than 30 days. See, in 30 days, if I don't get result, I will refer to surgery. If there is any problem, otherwise I will just keep as it is. Sometimes I will refer to homeopathy and I will tell you report some months. In 1 month, if I don't get result, I will not accept.
Sir, there are many cases, especially in female cases of thyroid problems. Most of the times it will be associated with one or the other related problems, maybe PCOD and others. Is there any specific line of treatment to be followed in that condition?
Simple. Females consider that females in India, especially in Kerala and little bit in Karnataka, okay, they believe that there are some special animals. Because they are also having 100% same calories like males. They also should run, they should jump, they should play, they should swim. But they don't, because society restricts them. Though they wish to live freely, the stupid society restrict their movements. Trans abdominis, rectus abdominis, external oblique, internal oblique, serratus anterior, and latissimus dorsi. All these muscles are almost very low tone in females of India. Only Tamil Nadu is exemption. Some part of Tamil Nadu, Chenkotai, Tirunelveli, Palankotta, there is a tradition where there is a full freedom. Nobody bother. But Kerala is horrible. Sorry. Now, situation is changing because this socio-economic factors. They're inviting a lot of diseases, including PCOD. It's a lifestyle disease. So thyroid also, every disease due to accumulation of lipoproteins and apolipoproteins are there more in females than in males because of this social response. That's why we cannot ignore this. This is because the society. I cannot tell more than that about it. Okay, so unfortunate to say, let's have no freedom. Three Swatantra Mahadi Manusmriti say in a totally different context which is misinterpreting. When mother, father, husband, friend, children, they are behaving like that. Women don't need a freedom. See, I'm coming back to this stupid society, cultural civilization. Okay, that is why lots of problems, females including stress factors, lots of problem, untold. That's why, sorry to tell doctor, when you asked, I told it.
Sir, but you didn't throw light on some Aushadha yogas. If it is associated with PCOD and thyroid problem, is there any difference in the prescription?
Saptasaram Kashayam is abundantly being used for managing both the situations before food. It is used for 4 months in 3 MCs. 3 consecutive MCs. Saptasana Kashayam with Gudana Budding Ayurveda Anupana. You see the Saptasana Kashayam, wonderful medicine. Okay, wonderful medicine for continuously taking 4 months before food. Buddha, Karna, Padu, Hingu, Ajya, Yukta. 5 Nipanas. It is wonderful to manage thyroid, IMC, PCOD.
Yes, sir. You were mentioning that apple, juice, ginger, and carrot juice, but how much exactly is the quantity that has to be taken? And question number one: suppose after taking this medicine or any other medicine, if the reports becomes normal, then when we have to stop the medication?
Wonderful. See, 21 days I told you to take this. In 25 days you check it. If it is becoming low, like we use Ayurvedic medicines, you taper 25 mcg each. I go. Usually I recommend it to people who never took medicine.
Yeah.
For
Even if the patient is also on medication,
they can, if it is not responding, you have to 20. So 1 or 2 cycle try. 21 plus 1 gap, then 2 times we can try. If not showing a response, we better not to. But this is very among people who are druggists.
yes, sir. Can 1 or 2 cases of hypothyroid in association with any other complications like that, obesity, etc. In those conditions, is there any specific steps of thyroid treatment? Obesity and along with that thyroid problem.
Very different because obesity usually we misinterpret as BMI. Obesity needs to be defined first. If I don't feel any discomfort because of heftiness, I don't need to call me as obese. If my mother is obese, I'll be obese. You don't need to treat for that. And if you do in any Prakriti Viruddha or medicament or other practices, including modern this managements for reducing the body weight as against the law of nature, it will lose your proteins in the hairs, spleen will become enlarged, eyesight will be lost, and at last your heart will be weakened. So you will be slim, but you will be useless. Your parents will be very healthy. Understood? Body mass index is a stupidity made for nutraceutic business.
Okay. Sir, there is a request that at least before winding the session, can you please explain one or two challenging cases that you have treated, thyroid, other associated complaints, etc. We will keep that at the end. We will chat at that end. Before that, more questions. And participants, please, most of the questions that I think are already answered in this session, like tapering the dosage, how to taper the dosage, then many such patya, etc. So, such type of questions we keeping so that we can wind up the session in right time. So is there what is the line of treatment in case of iodine deficiency and excess iodine related thyroid disorders?
Iodine deficiency, there is no lab to quantify iodine in the blood. There is no blood test to quantify iodine in the blood. That's the primary truth. Second thing, trioiodothyronine, which is T3, there is a deiodination. Please listen it. The conversion of T4 to T3, the conversion of T4 to T3 is called deiodination. So this deiodination is a contradictory statement of supplementation. So again, iodine uptake in the gamma imaging. Okay, these are contradictory. Actually, the emission of radioiodine, reflecting in the middle of the thyroid are only studied. No proper. I have got some papers. Iodine is a mandatory supplement in thyroid as not completely established in the research and development. That's why in 2013 there was an argument with many countries and WHO. So the iodine supplement was never instructed as mandatory in many of the countries, including India. Do you remember in early late 90s in radio we were hearing iodine daily, but now they say iodine is dangerous, and now we get deiodination salt. So we are actually in a strike to get pure salt from Thuthukudi. I want to drive the vehicle and went to salt fields and taking zero iodine salt because they add iodine when it's packing. Dangerous. Iodine is not advised in, especially in thyroid patients. So this concept hypothesis, it was a hypothesis, later it became a hypothesis, and all alternate hypothesis in a decade, all alternate hypothesis on iodine dependence thyroid function have become disproved in 2013. And nearly 2018, 5 years after the study, 2023, 1st of January, every scenario revolutionized. This supplement is also addressed as so ultimately it's a very controversial matter. So regarding the research of iodine, it's a bit of you just see you can get Google the utilization of iodine, biochemistry of thyroid, utilization of iodine in the biochemistry of thyroid. You'll get all the details. Utilization of iodine in the biochemistry of thyroid, starting from the preparation by the liver of DL, liver proteins. You get all the details. So that's why complete confusing.
Yes, sir. Related question. Is Rasna is Lucia Beta or Alpinia Kalanga?
Who has asked this beautiful question? It's a wonderful question. And that too in front of Sanjay. And he's here or what? No, he has left. Please don't. See, he's my farmer, my soul. Rasna, Sasna, Stona, Vena is the Aushata Sutram of Rasna. There are 23 Rasna are being used in India. 11 Rasna are documented as original resource of Rasna. The scenario became controversial by a book named Raja Nikhandu. Vision for Moola Rasna, Patar Rasna, Tara Rasna. Tara Rasna, Moola Rasna, Patar Rasna. Tara Rasna is Vandaka by Bengali Kavarajas, Moola Rasna, Alpinia, Calcaretta, Telanga, Lesser Galangal, Greater Galangal, Saitaminus a member, Kuche Lansoleta, which Gujarati people advocate, composite member, which is okay, which is Patar Rasna. They say methyl cinnamate as a marker. Sorry, methyl cinnamate cannot be considered as a marker of Rasna. It's based as unscientific, it is wrong. But Pluche and Ansoleta, Vanda Roxburghi are not genuine resource of Rasna. Kulinjana, Malayavaja, Suvaha, Surasa, Sugandha Stula Granthi, Ela Varni, Namarupa Jnanam, conclude Rasna as Alpinia calcaretta or Alpinia galanga. No controversy. That's the best Rasna, which is Vedana Stavanam, not pain killing. Vedana Stavanam is not pain killing, okay? So, that is what Rasna is finally is Alpinia calcaretta or galanga.
Sir, this is question directly of Galaganda.
Okay.
Siravyadha in Galaganda.
Sorry?
Siravyadha. Where to do Siravyadha in Galaganda? It has been mentioned as Urumula. Siravyadha, site of Siravyadha is Urumula.
Yeah.
Where exactly we have to do? And in which avastha we should do Siravyadha?
Siravyadha is a Shodhana Kriya. See, we need to do Andapajanam by 7 weeks. I have 1996 by my guide Dr. B.N. Joshi. Have you ever heard? B.N. Joshi from Andhra Pradesh in London. Venkata Narayan Joshi. Sir was my guide. I think you must be knowing.
Yes.
So he has done popliteal artery resection. Sorry, vein, not artery, so dangerous, sorry. Popliteal vein resection. After 49 days of oral medication of Bhaddhadarvadikana Krita and Bhaddhadarvadikana Kashayam. Saptamrata Loham, Chirabala Thailam, 101 Avarti, 2 times, 1 hour after food. 7 weeks, 49 days, then 50 days, he has done Siravyadha. It was very successful. And he was very famous doctor in male sexology or andrology, and also he was doing this kind of special treatment. I have voluntarily never done it. I have done other Siravyadhas, I have done Dattavoksha, etc. But even Alabo I have done, but popliteal vivisection have never been done, I have only seen. So that's, I think, one case I have done. I was assisting him. That's only experience I have.
Yes, yes.
Good
And
question.
is there any role of mudra in treating thyroid problems? Various mudras.
I don't know about it. Sorry.
Yes. Sir, which one is more complicated or difficult to treat, hypo or hyper?
Both are easy without drug history.
Both are easy without drug history. Yes, sir.
Hyper is more difficult with the drug. Hyper is more difficult with the drug.
With the drug. Okay, sir. And how do you decide sadhya sadhyata, sir? Any thyroid case come to you, how do you decide sadhya sadhyata?
Asadhyam, yapyam, anupakramam, post-surgical cases. Okay. Yapyam, anupakramam, post-surgical. And what is secondary to liver, breast, lungs, affecting thyroid after the resection? Impossible. Ayurvedic medicines are anupakramam. Kristara sadhya are patient on medications based on the hyper and hypo. Sukha sadhyam with no drug history.
Sukhasadhyam?
With no drug history.
Yes, yes, sir.
40 days matter. Uttanivas.
Sir, sometimes after taking medicines, Ayurveda treatment, the patient will feel better with all the lakshanas. He will be free from the lakshanas, but when we send the patient to do laboratory report, there will be no much change in the report. How to understand this?
Wonderful question. Very true. If the medicine is genuine, see, every plant contains phytosterol. It will give you a sense of well-being. So the comfort level, if you give any medicine, patient will get. Not only for thyroid, any medicine. If it is a government section, if you some any herbal medicine, concoction, you feel it because of the phytosterol in it. But if the medicine is good, genuine, what I already told, it will rectify that problem also. The report also will get normal.
Okay, you mean to say that in most of the cases it is because of quality of the dravya?
100%. If the medicine is good,
then if there is a clinical improvement, it must show the
100%. Printout and clinical both you will get.
Okay, then there is no possibility that clinically he is fine.
No possibility at all. Not a single patient I have got like that.
Is it, sir?
100%. Not a single patient. If I don't get result, I just reject in 1 month. And I refund this, we ask them, I refund them. I pay the money back. Rarely it happens. I don't like to give hard-earned money now. Like you people. I'm also like you. So I will not let me to pay.
Okay. Sir, how to understand the pregnancy-induced thyroid problem, and is there any specific Aushadha Yoga?
Wonderful. See, it's again a science of teratogenic hypothyroidism. Teratogenic hypothyroidism, which is not completely documented in modern thyroidology. It is not documented. Teratogenic thyroiditis, teratogenic hypothyroidism. It is, I already told you, start from the month of second trimester and actually become normal with the 6th month. But unfortunately, if you happen to check the blood test like a so-called protocol, 5.7, 6 point something, 7 points, and they will label him as a hypo.
Yeah.
They will start by torturing mindset that he will have abortion. Harassing. Basically, I will tell you it is because of toxoplasmosis. You know, toxoplasmosis virus, cytomegalovirus, CMV, herpes zoster virus, HSV, IgM, IgG, immunoglobulins, IgG and IgM, immunoglobulins linked with the CMV, cytomegalovirus, HSV, herpes simplex virus, and rubella are the common teratogens found mimicking this virus. This does never mean you already have an infection of this virus. This test indicates your immunoglobulins who are the mRNA are mimicking the note of this RNA virus. And also some DNA virus like HSV is a DNA virus, herpes simplex virus. It will not cause any problem. But if you start taking spiromycin, allopathy medicine, it will worsen the scenario. Nowadays they don't give it. So coming back, basically all these are unnecessarily fabricated stories. Pregnancy is not a disease. And the pregnant lady is not a patient. Let them deliver happily. Why are you disturbing unnecessarily?
But what is our role, sir, in that condition?
Our role, wonderful. Dr. G, from first month to 8th month, there is a Garpani Upacharam. It's wonderful. We are doing that in my clinic. My sisters, everybody are done Sukha Prasavam. Finally, Tangasari Karatam in 9th month. Sukha Prasava Karatam. First month, you can definitely do it. It's very easy. We have done lot of people, hundreds of people. Zero risk, not even episiotomy, not even stitch. You know, can you imagine it? Not even stitching. Sukha Prasavam, proper convulsions we get. So,
But how to reduce that TSH?
how to?
How to reduce the TSH? Because we have to send the pregnant woman to the gynecologist, then he or she will refuse.
Very good. See, to assess the risk of so-called TSH in pregnancy, you check the torch panel first. Second, at CRP, C-reactive protein, ASO titer, streptomycin. Okay, streptococcus toxic excreta, which is ASO titer. Okay, next one is this one. I forgot what is a very important test. Yes, serum calcium procalcitonin. Correct. Serum, very expensive test, procalcitonin. Okay, this much test you do. If they are normal, please don't give any medicines. Okay. Then 6th month it will become normal. Nothing will happen. 6th month. 6th month, it will become normal, 4.3 point. Even gestational diabetes, no need to worry. It's another topic. Okay.
Yes.
Next.
Sir, is there any relationship between thyroid problem and menopause? Because many of the women, they get diagnosed as thyroid problem at the time of menopause.
It is very risky to treat or start treatment during menopausal phase for thyroid problems.
Risky, sir?
Yes. Do not give any thyroid medicines 1 year before or after to the menopausal period. See, Jari Panchashata Kshayam, 50 years, from 48 to 52 years. Please do not start any treatment for thyroid problems. Because it will be leading to lots of estrogenic complaints. There are 3 forms of estrogen. You know estrogen? Estrogen, no? There are 3 types of estrogen. Estriol, esterol, estradiol. Estradiol will be highly deficient if you treat hypothyroidism for a lady on menopause, pre-menopausal period. So she will start getting diastolic dysfunction. Diastolic dysfunction, many more complications, including hot flush, calcium derangements. So better not treat, and nothing will happen.
But I think it is the observation of many of the practitioners that during menopause, either there will be increase in the sugar level sometimes also, or thyroid problems, lipid profiles also may hamper. So collectively then, how to treat it at that time?
It's a final time squeezing. 50 at a money making age. Nothing more than that. See, basically, do not start any treatment during the menopausal phase. If it is not mandatory, especially related to the hormones. Because the natural protection which a lady is supposed to have, if they are not underwent cystectomy, you should not start any medicines for thyroid before, after 48 and before 52, in general. And if she started to getting disappear the menses, like it become disordered, once in 3 months, that time you have to consider that it's a pre-menopausal period. Please keep quiet. Let it happen naturally. Whatever is blood test you get, it will happen, nothing will happen. 100% it is zero risk. It's a part of menopausal syndrome.
We should wait for
2-3 years, nothing will happen. Nothing will happen.
yes, sir. With this, we come to the end of the questions only related to the thyroid. But there are few more questions, and even I think sir would like to answer more happily for these questions. Sir, Hridaya is a sthana for Jnanavata also, then Sadhaka Pitta also, Kapha also, Rasa also. And how to understand this, sir?
In Ayurveda, Shiro Hridayam, Vastu Hridayam, Uro Hridayam has been told. So, Dashamula Sirahhristha, Stha Sarvam Sarvada Vapahu, Rasatmakam Vahandavata Tandibadhami Chestitam. Tandibadhami Chestitam. So, here, Hridaya is a concept. Any flow in terms of energy or liquid, when it is coming and going afferent and different, it is termed as Hridayam. So, Dhamani is narrow.
Dhamani is
Narrow.
but everyone is telling it is artery.
I will tell you. Nadi, Dhamani Sahita Siraya Nadi. Nadi Pariksha. Nadi is artery. Dhamani Sahita, innervated blood vessel is artery, which is the artery. Nadi. Dhamani Sahita Sira, it is Nadi. Dhamani, okay. Nadi Pariksha we do. Ida, Pingala, Udanan, Pranan, Vada Pitta Kapam, Rektam, Samanan. Okay, then Apanan, then dorsalis person posted triple artery. Vyanan and again Apanan. I'm coming back to Nadi Sthanam. So here, Hridaya is a concept of, I already told you, inward and outward. We don't need to worry about the meaning of Hridaya. Only thing, Hridaya is also assessed as or observed as Tala Hridayam, where Ichha, through sense organs, go to the Manas and bring it back as Chesta. So here, every places we use the word Hridayam. Okay, so Sira can be any blood vessel that may contain. Sira is a common term for a blood vessel. It may be artery, may be vein. Vetya Sira, Avetya Sira. Vetya Sira, Avetya Sira. It is not vein. Avetya Sira can be artery. So Sira means any blood vessel. Dashamula Sira Kristha, pulmonary artery, pulmonary vein, aorta, subclavian, all are having pure and impure blood now. So here, Sira means Dasamula Sira Kristha, Ashtanga Hridayam, Shadira Sthanam, third chapter, Angubham Shadiram. So here, Hridaya is a word denoting for many organs, not only as heart. Vyana is considered as a center of neurodynamics. Vyana Hridisthita. So, this is a प्राय सर्वाग्रे अस्ति शरीरं. So here, Padachedam, Anyam, everything we need to explain. It's a very big topic. Yes. Kandak Bharavadya, Pushtabhalamrata, Padamrata, Ayad Veda, Jiva Jasnanda. Wonderful sloka. But you need to do Padachedam, Anyam. So modern science has not grown. First of all, you try to understand the meaning in Kannada from Sanskrit. Then you try to understand. Then you try to translate to English, so-called English. What everybody exhort to talk and propagate. Then try to apply the
Sir, hypo and hyperthyroidism belong to which Roga Marga, sir? Or how to understand this Roga Marga?
Wonderful. It is Shakha, which is Bhagya Roga Marga.
Thyroidism, sir.
Shaka. See, Shaka Rekta 2 Shukla plus this one Tok are the means to manifest the disease, which is Bhagya Roga Marga. Good question.
So it is Bahya Roga Marga.
100%.
But what about the swelling, sir?
See, because of this Roga Marga, we can see the Vrtiksha Lakshana. See the Rekta Vrtiksha Lakshana. This one, everything is telling you is that.
Raktam Visarpapeha Vidradin.
Understood. See, Asthido, the Satanam, then the Satanam, then the Mamsa. What is that? I forgot. Yeah, same thing. See that. Sadhakariya, we have forgot the word, the chapters. Everything is coming under manifesto of Shakha Data Yoga, which is Bahya Roga Marga. No doubt. Nadi Satari. Thamani Sagda. That's correct. See here, Vatam Pittam Kapam. Radial, median, ulnar. Vatam Pittam Kapam. So there is a Nadi Pariksha. Sadhya Nadasa Chuktasa Sadhya Snaha Vasayana. Trutta Nadasa Buktasa Nadi Samanda Buchade. So here, Nadi Pariksha is a distinct that we are using for 3 purposes: for assessing body constitution, for diagnosis, for ruling out death. Rishta. I have been trained for that. Basically, my father's guru taught me that, Nadi Pariksha. So, Nadi Pariksha is a wonderful thing. I do it. But we need 20 minutes and should not suggest Nadas immediately after bath, immediately after food, immediately after massage, and truth, when they are feeling appetite, when they feel thirst, immediately after food. They are not supposed to do Nadi Pariksha. 20 minutes it will take. We are checking the Pradakala before Madhyana. Sure.
Sir, last question goes. As requested, many participants have requested that you have to explain in 2 to 3 the complicated challenging cases that you have treated, whether it is only thyroid problem or thyroid associated with any other complications, sir. Number 1. Then what is the last message to all the participants to become a successful practitioner, Ayurveda practitioner? How to stay focused, how to have that faith in Ayurveda, how to start their own clinical practice. What is your word, sir?
Wonderful. I used to tell you some disasters in my practical life of Ayurveda because I never had the gurus, because I had studied only by trials and errors. Please understand this. I am telling you very important information. I have become so-called good practitioner through many trials and errors because I had no books, I had no teachers. From 99 I started, 96 I started, but 99 I started to take challenging cases, including nephropathy is the most challenging cases, nephropathy, creatinine case, IgA, FSGS, IgA nephropathy, diabetic nephropathy are actually challenging, and lots of patients have died, thousands, because of my ignorance, because I had no teachers. I am telling in the early 2000, there was no other way for me in front of me. Do you get? But I am damn sure that I can save these people. When I taper cilnidipine, when I taper hydrochlorothiazide, when I tapered furosemide, torsemide, lesilactone, etc., when I stopped the diltiazem, decoction, that kind of categories, lots of people became complicated. Again, if I restarted the medicine again, I could not save them. Again, managing low hemoglobin among dialysis patients, people after erythropoietin injections, I was hardly trying my level best to save them because erythropoietin injections to manage low hemoglobin is worsening the scenario of nephropathy again. So I have tried my level every best to save the innocent people from the top of dialysis. That was the first challenge I've taken, and lots of people died. I had to sacrifice because no Ayurvedic doctor treats burning issues. No Ayurvedic doctor treats intensive care patients. So I had no other option. I was alone. Even now, I am alone. No support from anywhere. Zero support. I don't need anybody's support now. But I am very confident and optimistic now. Since 15, 16 years, I am 100% confident. I can claim through any court of law that classical Ayurvedic formations can save the really suffering people due to Western medicine. I can stop their medicines and they can come back to their normal life. Creatinine up to 5 I take now because once dialysis I cannot help them. Dialysis we cannot, once if we started, I cannot help. Final conclusion, that was a major challenge. Second, ILD. Lots of cases. Second highest burning challenge was interstitial lung disease. Third was a common asthma, bronchial asthma, systemic asthma, allergic asthma. What you will do? You will take epiphylline, terephthalin, retard, isn't it? 100 mg, 150, 300, blah blah, whatever may be. Then they will start inhalers. Will it cure? No. Then Astalin. Then will go to salmeterol, fumetrol, budesonide, fluticasone, propionate. 6-7 years. They won't stop it. Don't stop. Instruction. Scientific instruction. Scenario is worsening. Asthma became COPD, CCF, no problem. Take inhaler, twice, thrice, Diolin. Then last, after 10-11 years, they'll give you tiotropium bromide. Tiotropium bromide and fluticasone propionate combination or budesonide combination. Then they will name it as ILD, carrying cylinder. Interstitial lung disease. I have managed in Bombay. It was my brainchild, it was my dream project. But Navi Mumbai, I was working freely 4.5 years. 60 to 64 lakh per year I was earning for the investor. Only 1 lakh rupees per month rent for 5-story building. It was my challenge mission, freedom fight. Same mission of Subhash Chandra Bose. He went to Japan for INA. I went to Navi Mumbai for training Ayurvedic doctors to meet the challenges for this kind of case, ILD, coronary artery disease, heart attacks, MI, COPD, okay, pulmonary embolism, won't warp. Pulmonary embolism won't warp. I have treated, I am treating. Deep vein thrombosis on acetylone, tryptomer, etc. Crohn's disease, ulcerative colitis, all mischievous cases, but they are all, world is say, there is no cure, we cure. Using classical Ayurvedic formulations, that's what is being taught in the colleges, but we never mind. Ayurveda is such a wonderful medical system. It can cure every disease, provided medicine should be with best quality for the medical practice. So everything is business. Business is a very good word, but business is a service. That's why a shopkeeper is sitting in the road street, serving the public, supplying for his basic needs. He's doing service. So coming back, these are the challenging issues. I have faced that hospital shut down with COVID. Coming back again, at last, doctor asked me to tell my message. Speak to act and speak after it. Speak to act. Then stop speak. Then keep on working, not talk. After completion of the job, you speak. Then if you show me that proof by talking, I will call you one word. Do you know what? God. I will call you God. I don't have any concept on God. You are the temple of living God. Govinda. Go means word. Vinda, one who knew the meaning of word with the reference to the practice. That is Govinda. Any adverse environments, if you maintain the discipline of meaning of word through practice, you call us Gopala. So Chandracharya say, Bhaja Govindam. He renamed you. Muthamate. He already told it. So you depend and obey anybody in the world who understood the meaning of words with reference to practice, karma. Otherwise, nahi nahi raksha the dugarnya karna hai. Grammatical things will never save you. Thank you so much.
ಬೆಂಡಾಗಿ ಕಾಡಲ್ಲಿ ಹೋಗ್ತಾನೆ, ಕಾಡಲ್ಲಿ ಏನ್ ಸಿಗುತ್ತೋ ಅದನ್ನೇ ತಿನ್ಕೊಂಡು ಹೋಗ್ತಾನೆ. ಹೋಗ್ಬೇಕಾದ್ರೆ ಸೀತೆಯ ಅಪಹರಣ ಆದ ನಂತರ
ಹೋಗ್ಬೇಕಾಗಿರೋದು ಶ್ರೀಲಂಕಾಕ್ಕೆ.
ಎದುರಿಸಬೇಕಾಗಿರುವಂತದ್ದು
ಅತ್ಯಂತ ದೊಡ್ಡ ಚಕ್ರವರ್ತಿ ರಾವಣ, ಲಂಕಾಧೀಶ. ಹೋಗ್ಬೇಕಾಗಿರೋ ಕಾಡು, ಮೇಡು, ಸಮುದ್ರ. ಇವನಿಗಿರೋ ಸೈನ್ಯ ಕೋತಿಗಳು. ದಾಟಬೇಕಾಗಿರೋದು ದೊಡ್ಡ ಸಮುದ್ರ, ಸೇತುವೆ ಇಲ್ಲ. ಆದ್ರೂ ಕೂಡ ಹೋಗಿ ಯಶಸ್ವಿಯಾಗಿ ಯುದ್ಧ ಮಾಡಿ ಗೆದ್ದು ಸೀತೆಯನ್ನ ಕರ್ಕೊಂಡು ಬರ್ತಾನೆ. ಹೇಗ್ ಸಾಧ್ಯ ಆಯ್ತು ಕೇಳಿದ್ರೆ ಇಚ್ಛಾಶಕ್ತಿ ಪರಮಃ ಅಂತ ಹೇಳಿ. ಇಫ್ ಯು ಹ್ಯಾವ್ ದಟ್ ಇಚ್ಛಾಶಕ್ತಿ, ಈಗ ಸರ್ ಹೇಳಿದ್ರು
ಗುರುಗಳಿಂದ ನಾನೇನಾದ್ರೂ ಮಾಡ್ಲೇಬೇಕು
ಹಾಗಾಗಿ ಅವರೊಂದು
ಸಂಪೂರ್ಣ ಹಣ್ಣಾಗಿರೋ ರಸಭರಿತ ಹಣ್ಣು ಸಿಗುತ್ತೆ. ಅರ್ಧಂಬರ್ಧ ಆದ್ರೆ ಏನಾಗುತ್ತೆ, ಎಲ್ಲಾ ಹಕ್ಕಿಗಳು ಬಂದು ಕೂಗುತ್ತವೆ, ಆಮೇಲೆ ಏನೂ ಸಿಗುದಿಲ್ಲ, ಅರ್ಧಂಬರ್ಧ ಸಿಗ್ತದೆ. ಮಾತಲ್ಲ ಮುಖ್ಯ, ಕೃತಿ. ಆ ಕೃತಿಯಲ್ಲಿ ಅಷ್ಟು ವರ್ಷದ ಸಾಧನೆ ಇವತ್ತು ಎಷ್ಟು ಚೆನ್ನಾಗಿ ಮೂಡು ಬಂದಿದೆ. ಆ ಒಂದು ರಸಭರಿತ ಹಣ್ಣಿನ ಆಸ್ವಾದವನ್ನ ನಾವೆಲ್ಲರೂ ಸಹಿತ ಪಡ್ಕೊಂಡಿದ್ದೀವಿ. ಸೊ ಒನ್ಸ್ ಅಗೇನ್ ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಸರ್ for being here and motivating all younger generation. Thank you very much. ಕಾರ್ಯಕ್ರಮದ ಕೊನೆಯ ಭಾಗದಲ್ಲಿ ನೀವೆಲ್ಲರಿಗೂ ಒಂದು ಕುತೂಹಲ ಪ್ರಶ್ನೆ ಇರುತ್ತೆ. ಹಾಗಾಗಿ ತಿಳಿದು ಕೂಡ ಹೇಗೆ ಕೇರಳದಿಂದ ಕಾಂಟ್ಯಾಕ್ಟ್ ಹೋಗುತ್ತೆ. ಈ ಸಂದರ್ಭವನ್ನು ಬಳಸಿಕೊಂಡು ನಾನು ಅವ್ರ ಬಗ್ಗೆ ಸಲ್ಲಿಸ್ತೇನೆ.